Now broadcasting on Star Worldwide Networks, it's Healthy Senior Living with Smiles by Delivery. Healthy Senior Living explores all aspects of creating a happy and healthy senior lifestyle. As the premier mobile dental practice in Arizona, we have mastered the art of delivering the highest quality dental services in our patients' homes. This show will bring you an engaging and ongoing discussion with the leading voices in the field about the best options and strategies available to help seniors live healthy and comfortable lives. And now it's time for Healthy Senior Living with Smiles by Delivery.
And I'm smiling. That's because I'm here with Michelle Trent and our guest on Healthy Senior Living. I'm Roger Downey, and our guest today is someone who can tell you how to find an assisted care or facility for your elderly parents that would be appropriate for them. We'll get to Steve Gilbert here in a minute, but first of all, Michelle, a lot of what you do is involved in storytelling. It's for your elderly grandparents or even great-grandparents to talk to you so that the people, their descendants, benefit from that. You can play that kind of audio to grandchildren in the future.
Yes, absolutely. That's it's so priceless, being able to capture stories and memories. I mean, they are unique to each individual person, and it really does provide a connection between generations. I mean, think of what an extraordinary occasion it would be if you could hear from your great-great-grandfather in his own voice, talking about his experiences of the day. It would be incredible. And that's what we're trying to do today with Remembered Well, is just recording people telling their own story in their own voice. That's very key to it all, so that they can be connected to future generations. And most importantly, that we are preserving their place in this world, their history, and the wisdom that they've amassed. So that's Remembered Well. That's what I do. I love it. Love stories.
Sure. And you know, technology like that is so important now in medicine, because when you come right down to it, we have to explore various things to improve the health care and well-being of people. One of the things that Steve Gilbert does, who is involved with Real-Time Senior Living, that's the title of his company, and he produces an app that allows people to find the appropriate location or appropriate facility for an elderly person who really is not able to be independent anymore.
That's correct.
Steve, tell us about Real-Time.
First of all, Roger, thank you for having me here today. We're super excited. So Real-Time Senior Living was after spending several years in the industry, one of the first things I found as you're out searching for senior living, and this could be a residential care home, an everyday home that is in a neighborhood, or a larger community that you see out there as well. Typically, that will have 50 to 300 residents living in them. The first question you have to ask is, do you have availability? And if the answer to that question is no, the next 20 questions about your mom, the services they provide, the pricing, the room availability, just don't really matter. Right. And so we spent years and years helping clients find the right options. And I would spend anywhere from 6 to 10 hours, sometimes 2 to 3 days, to find options that had availability. And prior to this work, I spent 20 years in the financial industry building simple-to-use technology. And so I knew there had to be an easy, elegant solution that was simple, fast, and Real-Time Senior Living came about that. It's the first app that allows homes and communities to update their availability right from their phone. They can tell you the type of room they have, the services they provide, the pricing that they have. And then you, as a searcher looking for your mom, your loved one, husband, wife, whatever it may be, can go into our app or through our website, search based on the criteria that you need, pricing, the type of room that you need, a private room, a shared room, do you need a one-bedroom apartment, and we'll bring back those options. So something that used to take me anywhere from 6 to 10 hours can now be done in less than a minute.
What other search criteria do you have on there besides what you mentioned? I mean, how specific can you get to finding the perfect option for your loved one?
I think we want to make sure that we have enough that it's simple and not so much that it's overwhelming, because there's hundreds of options that you could look at. But we have about 20 different criteria that we allow you to search on, from the zip code or city that you want to live in to the types of services you need. Do you need activities of daily living, things like helping bathe, clean, get dressed in the morning? Do you need dementia help, catheter? So we can get into some very detailed services that you might need that are very specific to you. And then, so you've got the area of town, the services that you need, and then we allow you to choose the type of room that you're looking for. Do you want a private room? Are you open to sharing with someone where you can reduce your cost? So we really give them about 18 to 20 variables that they can zero in and narrow down their search criteria.
It's an economic situation for a lot of people because they're trying to get the best living situation for whoever it is in their family at the least amount of money. I mean, in a sense, you've got to look at the dollars as well as the options.
Absolutely. The cost is real. And I think what I found as I helped families for many years is a significant sticker shock when you find out the cost of assisted living. On the low end could be $1,800 on up to $8,000, $10,000, $12,000 per month. So it's very important to understand what your financial situation is, the types of services you're going to need. And the last thing you want to do, if you have a $2,500 budget a month that you've set aside to help care for your loved one, you can search and zero in on the homes or communities that can meet those needs. So in Arizona, to give you an example, there's over 2,400 options. There's a significant amount of options out there. It's overwhelming, right? And so there's no need, if your budget's $2,500 and you need activities of daily living, to bring back options that are $6,000 or $7,000 a month and may not provide those activities that you're looking for. So we really help you to zero in based on your budget and what you need to be cared for on a daily basis.
So Steve, you said there are 2,400 options here. Are those all available through the app, or how many options are available through the app itself? How representative of that is that of what's available in the community?
So availability changes on a day-to-day basis in this industry. And so what's available today may not be available tomorrow. So that's what real-time, it really is real-time. So these homes and communities can update their availability literally in real time. As soon as they say, I have a room available, the very next searcher can see that. Or as soon as they say, I don't have a room available, that is no longer available. So you'll see that fluctuate. We have all 2,400 communities and homes in our database, but the ones that we're going to show you are only the ones that have immediate real-time availability or will have availability within the next 30 to 60 days.
Okay, but it's not limited to a handful of communities. What you're saying is all these communities have the ability to put up what's available through the app. So
That's absolutely right. And we only show the homes and communities that have paid to market and share their availability with those that are searching.
And is that represented? Is that a big sample?
It's a very big sample. We've had anywhere from, at any given time, probably 250 to 500 homes or communities that are sharing their availability at any time. So very representative across all price ranges and all options.
Well, because there are so many, obviously it's difficult to probably assess them individually by yourself. In other words, going to each one of them and looking at them. You almost have to take them at their word, right?
To some extent. Julie Wentz is our vice president and business enhancement consultant, and she goes out with her and her team literally to the homes and reviews them. We also have a standard of looking at the Arizona Department of Health citations. So if we find a home or community that is really not doing a good job, that has a significant amount of options, we have a code of ethics, and we have the right to remove that home and option from the market. The other thing that we've done is, if we receive significant negative feedback from people who are working with the communities or families, and we're able to validate that, because of our code of ethics, we can take them off of the app as well. So we want to make sure that the homes and communities that you're seeing are high quality and can meet the needs that you're signing up for.
So you're almost providing a certain level of filtering for folks out there. They know that if they find something, comes up with a room available, you've already done some screening. It's not just any old person who says, oh, I want to have a room for rent downstairs in the basement.
That's right. For an assisted living facility in Arizona, every home has to be licensed with the Department of Health. So you have to have a license with the Department of Health in order to use our application. And we strongly encourage families. This is a tool. for families, for people, professionals that are working with families and placing them into homes, case managers, really run the full gamut. Anyone who's searching or helping families can use this app. We encourage them, though, to not rely just solely on the data. Go see the home, do your homework, make sure it's the right fit for yourself.
You mentioned you depend a lot on feedback from people who have used the home or have seen the home or whatever. Do you put those reviews on a website or what?
So that is something that we do have longer term that we want to incorporate, and we have that capability. And like any technology, you have to draw a line in the sand and say we're going to go to market. So we've gone to market with an incredible app that has more information at people's fingertips than's ever been available. We really want to empower our searchers with data that they can now go out and search. And that type of thing is a great idea, and it's something that is on our longer-term plans to bring in.
Is there a way to link to the Department of Health Services for checking the, as you say, any citations that the home has had?
Yes, we are working on that capability as well so that they'll be able to see it directly. In the interim, we do encourage them through our terms and agreements and our other materials that we have out there that they do reference the Department of Health website and look at the citations that the homes has as well.
How long has the app been in existence?
So we did a soft launch in November of 2017 where we made sure everything was working, that the homes were able to update. We had a small subset of homes and communities that we were working with, and then verified everything worked beautifully. And so we had launched really full launch in January of 2018. Okay. And I just want to give you some reference. So since we've launched this, the response has just been tremendous. Case managers, hospice companies, agencies that work with families, they really enjoy this app. It's the first time they have this data at their fingertip. So we've gone from 0 to over 800 professionals that are now using the app, searching 500 times a day, over 15,000 times a month since we've really hard launched in January. And a lot of that success in the searchers that we've have brought on is thanks to people like Julie Wentz, who are out there meeting and going to these hospitals, communities, working with discharge planners to show them the app and the power of it.
It's a great idea. It's almost one of those you think, why didn't we have this before? It's just something that would be such a great time saver, such a great tool. So if our audience, someone's out there listening and says, I need to get this app, how do they go about doing so?
Very simple. With any smartphone device, whether it's a cell phone or a tablet, an iPad, you can, if you're using an Apple device, you go right to the App Store, search for Real-Time Senior Living Search, and they can get our search app for free. Or if they're using an Android device, they can go right to Google Play. The homes and communities who want to market through us can use our Real-Time Senior Living app, which has a nice green logo to help differentiate the two apps. But it's right in the app stores.
The fact that you've had such a great response indicates probably the need for your service, but also demonstrates that a lot of people don't know what to do when they have an elderly parent or a spouse who has some kind of dementia, and they don't know what to do and where to go.
I would agree with that 100%, Roger. I'll back up 12 years ago. We were in that exact situation with my parents, and we had a loved one we cared deeply for, and we were at a very large institution here in town, and we came to the realization that they couldn't go home safely. And the reason they were in the hospital is because of something that happened at their home. And so with their agreement, we began to partner with the case manager, and they handed us a list of 100 options in the local area with no information on pricing, availability, the services they provided. So 2.5 weeks later, we found what we thought was the perfect match. And the day that we introduced this app, one of my family members called me in tears and said, can you imagine had we had this app 12 years ago, the amount of time it would have saved us not searching, calling homes that had no availability, that were outside of our price ranges, that didn't provide the services. So this is really something that we've leveraged to the technology, my background in being able to build simple, easy-to-use solutions. And we've come up with a solution now that anyone can use, and we're very excited about it.
That's a very interesting prospect that you present to the people that need it. So we're going to come back and talk to Steve Gilbert some more about real-time senior living. But first, we need to take a break, and we'll be back after.
Healthy Senior Living will be back right after this.
Real-Time Senior Living is an innovative mobile app for senior living that directly connects those searching for available options in independent living, assisted living, and memory care in real time. Let Real-Time Senior Living be your direct connection to available options. Whether you are searching, reach out today to realtimesl.com or call us at 888-624-8587.
Have you ever wished you knew the story of your great-grandparents, or maybe even your own parents? Hearing personal stories is an irreplaceable way of understanding our loved ones. Recording your story is a precious gift for future generations. Now there's a simple option for getting it done. Remembered Well is an audio recording service that easily preserves your cherished memories. In a few guided conversations, owner and personal historian Michelle Trent will help uncover your family's unique story. This custom narrative is then professionally edited, digitally preserved, and ready to share for generations. It's your story, told your way. Find out more at rememberedwell.com. Now, back to Healthy Senior Living with Smiles by Delivery.
Welcome back to Healthy Senior Living, where we are talking today with Steve Gilbert. And Steve Gilbert, he is the founder of Real-Time Senior Living. And Real-Time Senior Living is an app, very simple. He described it, how you can download it to your phone, and it helps you to find availability for the right location in the Valley for your loved one. And Steve, like so many things, this was sort of the idea, I guess, was birthed out of necessity, right? You described your experience of you had to dealing with this with your parents. You were given all these options. How do you sort through them? And as a result, you came up with this app. So I'm wondering, what kind of feedback have you heard about the app for people that you know that have used it? I mean, how significant has it been in their lives?
The feedback has been very overwhelming, and I think to your point, when you build something and you see there's a need for it, you hope that people find value in it. And the fact that the response in adding over 800 professionals in the Arizona market that are now using this app, in the number of searching they're doing every day, is showing that they're providing value. But I'll give you a very specific example. We had a gentleman that reached out to me about a month after the app had been introduced and said, Steve, I want to tell you how much this app has changed my life. Some of the things we talked about earlier, taking 6 to 10 hours to just search and then setting up tours maybe 2 or 3 days later to take your clients or patients out to see the homes. He called and said, Steve, in 1 hour, I found a home on your app. We did a tour, and we signed a contract the same day. That's something that would have never happened prior to Real-Time Senior Living. So it's really changing and making a difference in people's lives with the number of hours they're having to invest. And the homes can spend more time focusing, and communities focusing on their clients and other things that they need to be doing, and less time marketing their home. And those that are searching can now really do this very quickly and spend a lot more time with their family member instead of just trying to find them the right option.
Yeah, there's got to be, I mean, there is a sense of urgency, right? When you need to find a facility, a place for your loved one, and when you can't find that and days are passing, and what do you do? And then there's probably this tendency to just take whatever is available, and that's not the best option.
I've heard that from a number of people who got into this, and they just took the first thing that was available, and or was referred from a friend of a friend, without doing a lot of legwork to find out. So, our whole goal here was really to empower the searchers and give them information that wasn't available before. They in the past, they used to go online, and if you go online, the number of online websites that are out there are even more overwhelming than the number of the 2,400 homes that we talked about. And rarely, if ever, do they have availability information and the information about the services they provide, the rooms that they have. So you can spend hours and hours and not even get the amount of information that you can find in less than a minute with our app.
In fact, we were talking about this during the commercial break. This isn't just for people who are, elderly and can't necessarily take care of themselves. If you have an injury and you need rehabilitation, oftentimes that requires more than just sitting around the house watching TV, so that you also can find a rehab facility as well with this app.
Just one point of clarification on that, Roger. That is a next iteration that we're adding to the app, so I apologize. So that is a big piece too. There's families very rarely go right from the hospital to assisted living. Usually there's been something that a trigger event that's happened in their life, and that needs to make that transition. But oftentimes they'll first transition to a skilled nursing or maybe an in-home care company. So that we realized that assisted living was really just the first part of what we needed to incorporate in. So skilled nursing and in-home care and those types of things will soon be on our app and available for people to search on as well.
And of course, assisted living is sort of the stepping stone to nursing homes because, eventually somebody can't take care of themselves even in assisted living.
Correct. So as you go through just kind of the care levels through life, you're absolutely right. At some point, you may need full skilled nursing, that you need a doctor or a nurse there 24 hours a day, and that is going to be outside of the levels that can be provided by the assisted living homes. Arizona is very unique in the level of care that they can provide at the assisted living communities. There's 3 different levels in Arizona, but I'll just talk to the directed care level. The licensing that they have at directed care can provide very high level of care. So the vast majority of people will not have to go into skilled nursing in Arizona, but that's still going to be an option that some are going to have to get there eventually, that the care they're going to need on a daily basis will be higher than the assisted living communities can provide.
You had talked about rehabilitation being sort of one of the next levels that you want to add to the app. What are some of the other things on the horizon that you're thinking that you want to incorporate now that the app's been live for 8 months out of the year? 8 months? Yeah, 8 months. So what have you learned? Where do you want to go? Where's this going to be in 2, 3, 5 years?
When I was first introduced this app, I had a gentleman that had been a part of one of the major apps, I won't say their name, and had introduced it across the country. And he said, Steve, one of the biggest challenges you're going to have is figuring out where to put your focus next. You're going to have a lot of ideas and things coming at you. And so we are taking, I think, the appropriate steps and measured steps. We went in, we've proven it works in assisted living, memory care, and independent living. And so we're now stepping into skilled nursing like we talked about. There's other options out there in the industry around low income and some of the other services that are needed on a daily basis that discharge planners are dealing with, that we want to begin to tackle those steps next as part of our app as well. And we've already proven that we can get the data and share it real time, and making a very simple, easy search can be leveraged across a number of different industries now that are in the medical field as well.
I would imagine there are communities out there that aren't currently a part of the app. Maybe they didn't know about it, or maybe they thought, well, we'll give you some time to kind of get it all working just properly. So how do they now connect with you in order to be represented on the app?
So we recently had a great article by the Senior Housing Forum that came out, and they are a national press. And so we were excited about that article because it helped introduce on a national basis, and we're ready to go national with our app outside of Arizona. We've launched now in Nevada and California, and we're very quickly and rapidly expanding outside of that as well.
Oh, wow.
So the biggest challenge we have, like you just hit, Michelle, is making sure that we are getting the word out there about what we're doing and how simple and easy it is to use. We are the first app that allows communities and homeowners of residential care homes to update their referral sources right from their phone. They don't have to call, text, spend hours emailing people like they've done in the past. And so it's new, it's innovative, so part of our challenge is helping them to understand exactly how this works. But once they see it working, they get the feedback from the users, they're very quick to adapt and come on the app. So that's our biggest challenge now, is getting the word out about what we're doing through our website, our marketing, and through our Apple and Google Play stores is the way for them to connect with us.
You mentioned that the app is free to the people who would be obviously searching. Talk about your business model. How do you expect to make money from this?
Yeah, it's always changing, I think, as any startup company, especially in the tech environment. But we want to make sure that the app, the people who can use it, who can search, we believe by providing it to them at no cost, we're giving the homes and communities that market with us the most benefit. So we didn't want to charge people or have placement fees that might keep them from moving forward and using the search app. The way we've monetized our company is through our communities. We charge a very nominal fee, $275 a year right now as our introductory rate. Because we are new, we realize we're changing the industry, innovating the industry. We want to get those early adopters an opportunity to come in at a very nominal rate, something that has low to almost no risk at $275 a year, and help open this up and get them more exposure to the rooms that they have available. Hopefully, and our goal is to help them fill their rooms faster.
Well, by spending $275 a year, they're only spending about $25 to $30 a month. And that's insignificant when it comes to filling that bed, really.
It really is. The cost of turning a bed for a home is somewhere in the range of $3,000 to $5,000. For every day that they have that bed that is sitting empty, they're looking at $100 to $200 a day, depending on the price that it is for their room. Plus, when you figure out their time of reaching out, marketing, and getting it out, it's significant. So for $275, they are getting a tremendous amount of exposure. The searchers are doing, like we talked earlier, over 500 searches a day from our professionals in the Arizona market. We're reaching thousands online. So we're just continuing to build this and provide more and more value. So I agree, those early adopters who came in the first couple months, they saw where it was going, they saw the vision, and they've been a huge part of helping us build this to add the value in the searches that we have. And we rewarded them with a free trial initially and very low cost. And even those that are coming on now at $275 are getting a tremendous value. There's no other solution out there that can provide 15,000 views of your home or community on a monthly basis like Real-Time Senior Living is doing for our homes that market with us.
Now, even as I drove here today, I see construction underway. They're building new communities, senior communities all around where I live. What kind of availability is there? Obviously, there's the need. They're building out for it. So if I have the app and I'm looking for something in my neck of the woods, is it likely that I'm going to get options back, or are they very few and far between? Are these places just filling up quicker than the availabilities are becoming open?
Absolutely. I think you're seeing a couple things happen in the Arizona market is I'm sure your listeners have heard the stats. Over 10,000 people a day are turning 65. The baby boomers are really exploding in this market. And so you're starting to see the communities and other homes are building up rapidly to help, because it's estimated that 70% of us are going to need some type of long-term care during our life. So they're getting and building up for this. But if you search within your area of town, zip code, or city, you're going to find options that have availability. So it could be anywhere from a couple options that have immediate availability to maybe 15 to 20 different options depending on where you are in specific area of town. The other thing that's really neat about our app is we have a map as well, so you can look at a map view and literally zero down to the street crossing if you wanted to see what's available right in your neighborhood. One of the things that's tricky and challenging with these homes and communities is, unlike the hotel industry that has signs that are blinking telling you there's vacancies, these homes and communities are invisible to you as you're driving through oftentimes. You don't know where they are. You may have a care home right next to you and not realize it. So what we do is we make the invisible visible by bringing them on a map, showing that they have availability and the information that our searchers need.
Well, that's part of the reason why people choose a home, is that it's close, it provides the right level or care of comfort, and obviously you can't figure all of that out in even a day. You've got to spend a lot of time unless you're using this app, which is Real-Time Senior Living. And you can find it again on your phone in the iTunes or App Store, whichever. Just search for Real-Time Senior Living. Steve Gilbert has been our guest. He is the founder and the person responsible for this app. And we're so fortunate to have him on our show today.
Thank you, Roger and Michelle. Can't thank you enough. We appreciate the opportunity and hope that we can help the families out there by empowering them with information they didn't have in the past.
And we invite you to join us the next time for another edition of Healthy Senior Living with Smiles by Delivery. Michelle Trent and I will be here again next time. I'm Roger Downey. Thank you for listening.
Thank you for listening to Healthy Senior Living with Smiles by Delivery, the premier mobile dental practice in Arizona. Catch the show live each week at this time or 24/7 anytime on demand on StarWorldWideNetworks.com.